All right. My third interview here during this this coronavirus outbreak, COVID-19, a pandemic. For the first time in my life, I've lived through a pandemic. So I'm here with Darian Bennington. And Darian, will you just introduce yourself, say, your career, how long you've been a part of it, and like give the viewers just a perspective as what your angle is, for this COVID case.
So my name's Darian. I've been a nurse for probably 3 years, maybe a little bit over 3 years. I work in one of the ICUs in one of the Metro Detroit hospitals. And it's been a trip lately, I can say.
Of course. So from all the research I've done, you said Metro Detroit, Wayne County, and the two other counties make up 88% of the cases in Michigan. So you were literally in the epicenter, as you'd call it, the hardest hit spots of Michigan, right? So I want to take you back. When did you first hear about COVID-19? Like, give me a rough timeline, and what was your initial thoughts, feelings, reports that you got? How did this thing start from your perspective?
So we probably started getting COVID patients and hearing about it around maybe March. So my unit is technically the neuro and trauma ICU. So with COVID patients, they're technically considered medical. In my hospital, we have two other medical ICUs that needed to fill up first. And at that time, the patients weren't critical yet. So not the units filled up. And then we started to get about maybe like one or two. We were treating them just like any airborne patient that we've had. Like, we've gotten TB patients. So we were putting them in negative pressure rooms, treating them just like normal. They weren't super sick yet. And then our ICU started filling up like crazy. In my hospital, we have 5 ICUs with 20 beds each, and they soon all became full. Our ER was at capacity instantly. A couple of my friends who are ER nurses, they were having a rough time. I mean, you have about 1,000 people coming in throughout the whole day. A couple of our other units were getting slammed, people who weren't intubated or anything. And as the weeks went on, it was just starting to fill up like crazy.
So that's where, from my understanding, that was where the idea of like flattening the curve and social distancing came in. The idea that was presented was, because we know that like flattening the curve or social distancing doesn't stop a viral outbreak, but the goal was to not get us to the point where we couldn't treat the people that needed it, right?
Correct. I think they were definitely focusing more on the healthcare system. I got somewhat of the shutdown. I get it, because you can't slam us. I mean, once we're slammed, there's nowhere to put anyone.
Sure.
We've definitely had points where ER in the past, usually around flu season, they get slammed, and then you have people in the hallways, which isn't appropriate. Us nurses don't want them in the hallways. So we got that. Yes, we needed to flatten the curve a little bit.
That's happened before. I mean, my understanding was like when the hospitals got overrun, this is the first time this has happened in forever. Or does it, like, during events before, you've had hospitals get overrun where about the same level, not nearly as bad?
We've never had like our whole hospital be overrun. It's just been the ERs, but that tends to happen almost every year with the flu season. Everyone comes in for even like a cough, and the ER at that time can't turn away patients. So they're seeing everyone, even if it's for the littlest things. But then when COVID started, we kind of said, if you don't have these symptoms, if you're not sick, then try not to come in, because you come into the ER and with all these COVID patients, you're
probably going to get it. Yeah. So I want to approach this from a couple of different angles. So I don't have any understanding of the science behind like a ventilator. Like, I don't understand. So let's say someone that's, doesn't have a major comorbidity. They're not elderly. They're younger people, because I was seeing all in the news that like younger people are being put on ventilators. And from what I could understand, the chance of dying once you're intubated is very high. Like, from what I read somewhere, is like 4 out of 5 people that get put on ventilators don't come off ventilators. So how many extreme cases did you see where people getting ventilators right away? Is that outside of the normal? Do we ever ventilate for something like this previously at this type of rate?
I don't know if we if you're trying to ask if we intubated them too quick. A lot of them, we noticed, yes, their SATs were very low, so they do get intubated. As for age, yes, young people, I feel like we all saw in the media between 60 to 80, and on our unit, we seemed to see the trend of 30s to 60s, which was crazy for us because we're like, this is all of our parents' age. Some of us, this was our age. I even know on one of our units, not mine specifically, there's a 25-year-old, which is exactly my age. I mean, I couldn't imagine right now being vented.
Of course.
And as for coming off of it, I can say we tried to get the numbers. No one's really telling us yet, and we haven't kept track of our unit specifically. But we haven't had too many leave yet. I think we're around 10 who's been discharged off our unit. But we've had quite a bit of deaths.
So you're in the middle of the pandemic. How many people would you say had to be ventilated during this thing? And what are the guidelines for ventilating someone? Because I mean, again, it's not my field, but I knew that there's a certain oxygen level that you monitor. When I've been in the hospital before, there's a certain, body oxygen level. Now, I remember when I was in the hospital, when it was dipping down to mid 90s or lower 90s, they were concerned. But I've heard that people were coming in, walking and talking with significantly lower numbers than that. So does that does that change the way that we are going to have to understand those numbers? And what were the guidelines when someone came to you? What makes you decide to put them on a ventilator where it's up to 80% of them, once that happens, that could be it?
So as for the guidelines, roughly on our monitors in the ICU, even just before our alarms didn't start kicking in till the O2 sat went below 90%. Yeah. That's nothing to be too worried about. I mean, people who have COPD from smoking, a lot of them sat normally at home in the 80s, and they're fine. I mean, not ideal for anyone's body, but they can be at home totally fine without knowing that they're sitting in the 80s.
So it's not an emergency if you're in the 80s. It's not an emergency.
Not yet. I mean, like any routine, we try to start with other ways of oxygen first. Nasal cannula is usually the first one that goes up to 6 liters. We were then going to non-rebreathers, which it can go up to 15 liters of oxygen. And then we were starting high flows. The big thing for us is we were running out of high flow machines. So then we were doing nasal cannulas over high flows, which is not a protocol normally. But the anesthesiologist and the doctors were letting us. And then once they start setting low on that, that's when we had to intubate them. For guidelines, it was about when they were satting below 80% continuously, 10 minutes or greater. Then you have people who are breathing 40 breaths a minute, which is not ideal. I mean, but if they were sat in low 90s, we were okay with that.
Gotcha. So as soon as it started dropping below the 80s, they're going to get intubated. Now, do you know that, were you privy to the fact that, 4 out of 5 that as soon as we cross that line and we go into ventilators, stats say that are going to pass away? Or is it but when you're below 80, it is what it is, you're going to die anyway? I don't really understand the science behind that. So I'm trying to understand that better. And then we'll move on to other questions.
I feel like that's kind of hard because unfortunately in any unit, so for us, we get all the patients once they're intubated already. Not many patients.
They come to you intubated.
Correct. We really, for this COVID specifically, because all the ICUs were filling up, we weren't taking anyone until they were critical. Otherwise, the other floors could manage it. And even us ICU nurses, we're getting pulled to what we call progressive units, which are step downs from the ICU, and helping those nurses till the patients got critical. But these patients wouldn't be coming to us till they were intubated and, sadly to say, almost crashing. And then after that, it's hard. We don't see them after either. Once they become okay that we feel that we can get them off the unit, we transfer them out. So it's hard for us to say, like, even like for our unit, like the statistics of our patients that we have gotten off the unit, honestly, if they've even made it after that, because we just don't know anymore.
Sure. So I have a question then where I want to talk about all of our coronavirus reporting. The way we were coming up with, what kind of threat we thought this was we were looking at people that are hospitalized, and then we were looking at the amount of deaths, and we were creating correlations there. We were saying, hey, if 30,000 people got it and 3,000 people died, that means 10% of the people that get this die. Well, that doesn't take into account like any mild cases. That doesn't take into account any cases of people that get coronavirus that are maybe asymptomatic, that although they have the infection, their body's fighting it off. And, as asymptomatic in those things, I don't have to explain them. And moderate cases. Are you seeing that all of the people that you test positive for coronavirus have severe reactions, or is there a large group of people that have either moderate, mild, or, asymptomatic cases with coronavirus?
It's been crazy and I feel like that's what's making it hard to treat is everyone has been different. Us nurses have gotten it. Two of my friends who I work with tested positive. They were probably sick for about 3 days. And then they started to feel fine. I mean, they said they probably had the worst body aches they've ever had, but they're back to normal. Even my dad knows someone where he got it and his whole family got it, and his kids barely had any symptoms. Now, yes, they're kids, their immune system's better, they have no other issues. And the kid was still out and about, not out and about in society, but like able to be outside and not having a hard time breathing, nothing, like still able to go about normal life. Where other people, the patients I've seen, it's a complete 180.
No, of course. I mean, with any viral infection, you have the extremes, and then you have the very mild cases or the non-symptom cases. So I guess where I was going with that is it was presented as if basically anyone that gets this is going to have a severe chance of passing away. And I feel like that type of fear and that type of information causes a lot more of a ripple effect, because if I think that, hey, if I get this, there's a chance, even as a 32-year-old guy that's in good shape, that works out, that does these things, that I'm probably going to be intubated. That is a whole different reaction than, hey, if 10 people are to get infected, one of them are going to be hospitalized, and then, on 100, 10 people are hospitalized, and whatever the ratio is. But just acknowledging that, hey, no, not everyone that gets coronavirus is going to have a severe reaction. There's obviously like a spectrum. There are the extremes that you witness firsthand, but then like you're talking about, there's the children that live perfectly fine with this. So I want to go to, and I don't know how well you understand this, one thing I heard over and over in multiple discussions with nurses, actually, where they kept telling me, like, James, what you don't understand is, since this is a novel case and we don't have a vaccine, there's no treatment. But my understanding, I mean, I'm going to kind of make a funny analogy here, but like when you were a child and we got sick, we had a fever, and your grandma would tell you, like, here's some chicken noodle soup and lay down. I try to study everything I encounter in life that I want to learn about. And what I had always learned about viruses and immune responses are, a virus is like a non-living RNA protein that uses us as a host. And overall, like, a virus doesn't even want to kill us. It wants a host. So if it kills the host, it's not a really good virus. But with that being said, where I'm going with this is, when you get a viral infection, all we really do is support the body's ability to respond to that virus, produce antigens, and then that's what immunity is. And a vaccine is obviously just a synthetic version of creating that, right? Like, so I get the coronavirus, my body produces antigens, it learns, my B cells and T cells learn how to combat that, it kills off the virus, and that is what immunity essentially is, and what vaccines replicate. So when you have all these people saying there's no treatment, someone that doesn't understand that type of process thinks, oh my God, if I get coronavirus, I'm probably getting intubated. There's no treatment. I'm going to die. And that type of misinformation, I feel like, pushes the wrong story. So tell me, am I wrong in my understanding of viruses and our immune response? I hear now in the media people saying, like, until we can test everyone, there's no way we can open back up. Well, if you believe that coronavirus has a phenomenal chance of putting you on a ventilator, I could understand that. But if you realize that your immune system can combat viruses as long as you give it what it needs and support rest, fluids, all of those things, it's not a major threat to your health. It's just not. I mean, there are cases that are extreme, like you're talking about, but there's cases that are very mild or no symptoms. Give me your perspective on that.
So I think it's hard to say, because from the nurse side, do I think this is absolutely serious? I mean, yes, because there are a lot of people who are dying from this, but then I do get your side too, because it could be with anything. There are people who die from the flu every year, but that keeps coming back, but no one's too concerned about it. It seems like
Why is that? So because I looked up the statistics. I've read up to 80,000 people might have died in 2017 from the flu. That is a staggering number that coronavirus is not even predicted to reach. I mean, that is staggering. I mean, when you put it into proper perspective and you look at the, over 300 million are in America, it is a smaller number. But still, I mean, 80,000 deaths. We don't bat an eye. We don't stop going to Starbucks. We don't cover our mouth. We do nothing. But this coronavirus has like a power to it that the flu didn't even come close to. Why is that?
I just think, for one, the media didn't help. Two, I think doctors are still trying to figure out ways to not necessarily resolve it, because, I mean, we still don't have a complete stop for the flu. I mean, we have vaccines, but it doesn't.
I mean, we've had decades of time to try to look at the flu. We've got vaccines. We've got all these things. And imagine that, because people would argue that to me, and it actually made me feel worse, because I'm going, we have all of this time, information, vaccines, all these processes, and the flu is still killing up to 80,000, which is more than corona. Shouldn't the new scary thing be worse?
Right. And I think that's what's scaring people, is because it's new. We've never heard of it. Doctors are still trying to figure it out, which I totally get. I mean, I think, too, people are worried we don't have a vaccine. There's no direct medication. I mean, at least the flu technically is Tamiflu. We have no medication that can full-blown prevent this or improve people. So I feel like that's what's scaring people.
So let's talk about viruses and immune system. Go back to that. How does our body normally combat a virus? So I get a virus, there's no treatment in the world. Am I just dead, or what takes place?
No, yeah, your body just has to fight it. Your immune system does, and hopefully it produces antibodies. And essentially, yeah, I mean, it is where your body just has to take time to fight this bacteria. And if it doesn't. And I feel like that's what people are worried about, is because if your body can't fight this, then
Sure.
you do go on the decline. But then there are people who can. So
what we would really need to have proper perspective then is we would need to have a true reality of the virus to know what is the case fatality rate, what are the chances, with the flu, we know, hey, if you get it, absolutely, it is bad, people do die. But if 50 million people are infected and only 60,000 die, you have to make it proper perspective, right? Because that's a huge difference than if 100,000 people got it and 60,000 died. That's worth shutting the world down over. So
right.
So it's all about perspective with things like that. You got to be able to fit it into that niche of how much of a threat is this to my life? So I want to change to a category you might not know a lot about, but you might be able to inform me. So I went to the CDC website and I tried to figure out exactly how are we reporting COVID deaths, because that's a massive thing, right? So from all the research I've done, spending probably more time than I ever should have reading through the CDC website, I've driven myself nuts, but I have not found a single place where you can find the COVID death statistic with verified data that says, yes, this was a COVID death. Yes, we have a test to prove it. Yes, we can confirm that. Every single report, without one exception that I found, shows COVID deaths and anything presumed to be a COVID death, regardless of blood work, verification, nothing. They only report to you this, what? Why wouldn't we show people? Because right now, the numbers are what they are. We're trying to figure out how many infections have taken place. But why wouldn't you say, this is how many have actually been infected by coronavirus for sure, and out of those cases, this is how many have died? We know these stats, right?
Right.
Why would we muddy up the water in such a difficult time where millions of people are losing jobs, businesses are going under forever, domestic abuse is up. There's a lot of things going on. If the virus is terrifying, you don't have to, pad it up. I get it. How are we reporting this, Darian? And I'll just stop the question there. How are we reporting these COVID deaths?
So I can say for my hospital, what we have to do is when a patient passes, we do our normal work. We call gift of life, which is for any patient. Any patient who dies in the hospital, you call
Heart
gift of
disease,
life.
anything. Doesn't
Yeah.
matter. They die. Okay.
So then they ask if they had COVID. You say yes. Now, Gift of Life is its own organization. They just check to see if they can be a donor or whatnot. We now have a system then too who we have to call is like kind of an emergency command center that's in our hospital. I don't know if it's our hospital's employees or if it's the state. I've never asked them that, but we have to contact them, let them know that a patient just passed. They ask if they had COVID. We say yes, and that's the end of the phone call.
So now that yes is based on what? Like how do we know they had COVID?
Because we've already previously tested them with a swab.
Okay, so the positive test, you're saying yes, we've verified this person has COVID, and then it goes from there.
Right. Now, if they didn't have COVID in their chart, if we've tested them and it's been negative, we don't have to call the command center. So we only call them to notify patients that have tested completely positive, and it says it in their chart. The labs reviewed it, and then we let them know. As for where it goes from there, I have no clue.
So I can't name this person, but I am trying to get them very hard to come on an interview like you are right now. But I have a friend that I've known for many, many years who works at Sparrow Hospital who reached out to me seeing my post and said, hey, I'm going to let you know, I basically got let in by his wife on this information first, and then we talked about it. But basically 2 people died in a car accident. They went to Sparrow. They were tested for COVID, and it came back positive. And then that is being sent into the COVID death count. Now, that's first massive speculation. I didn't witness it go down, but that's very eye-opening, right? We should never inflate something like that. So I kind of let it go, but I'm still pursuing to get that person to speak up. But then I saw on the news, the public health director for Illinois openly said, and I'll send you the video right after we finish this, openly said, the way that we are determining COVID deaths is anyone at the time of death, despite the cause. It could be clear alternative cause. It could be a heart disease. It could be hospice. It could be anything. If they die and the test comes back COVID, we are reporting that as a COVID death.
That's exactly what we're doing. Yes.
That's unbelievable so those numbers are so unbelievably inflated that it's not, I mean, that's just not reality. Now, don't get me wrong. If you wanted to put one chart where you said, right here, these are the people that came back with COVID deaths that had passed away. That's one thing. I understand that. Okay, so maybe that helps us figure out exactly how widespread it was. I understand how you might be able to justify that. When you add that in, and then you're going to show people a death rate where all of our society is determining our actions, like I'm gonna lose my entire life's work in business if I can't open next month, right? And I'm sitting around waiting, going, you know what? If up to millions could die, and I'm trying to protect the people that I love and the people around me, I'm willing to sacrifice. Like, I'll be James Gray in another avenue in life if I have to. But when there's that type of manipulation and numbers, to me, that's terrifying. So you understanding that, because I saw it in Illinois and I said, oh my God, that's criminal. That's unacceptable. So that's what led me to saying, I'm going to find the actual number of pure COVID confirmed deaths, and you can't do it. No, nowhere on the CDC is it listed without presumable, non-confirmed. They're all in one. So how did they explain that to you, Darren? How does that get passed down, especially when our nation is making our decisions based on the threat of this virus, and we are doing that?
That one's hard because, like you said, you can't get a complete number. Essentially, is what I've seen is we're pretty much almost testing everyone once they get to the ICU. I don't know if they're just worried they might decline on our unit if we haven't tested them already. So then, yeah, like you said, if they were tested positive for COVID, but they're in there for something else, and let's say they pass, that we then have to say they were a COVID positive patient, let this command center know, and they probably report it to the state or whoever. So it is skewing numbers probably a little bit, yes.
So a little bit. Think about it this way. Let's do I'm big on analogies. Let's pretend the flu infects up to 50 million people here in America. You know all about the flu. Imagine if the average number of people have died in America. I didn't know these stats before this, and I'm blown away. It's just under 2.8 million people die in America every year. That's unbelievable. That's over 7,500 a day. Imagine if every single person that died, we tested them for influenza, knowing that up to 50 million people get infected, and at the time of death, we reported those as influenza deaths. That would be millions of deaths to influenza. You would think that if you didn't leave your home in a bubble wrap, that influenza was going to get you, right? That,
which then becomes...
Who can I interview to ask the reasoning behind this?
Yeah, that I don't have an answer for you. And I think that's what's hard is because, too, we're having a lot of patients who are passing also have other comorbidities. So I don't know if you can necessarily say you pass from COVID. Now, I think our more sick patients have a relation to their comorbidities. The COVID made it worse than probably it already has.
And I would even be fine with that being an account. I would be fine with anything where COVID even like is a reasonable acceleration of their death. But if I die in a car accident, if I murder someone, if I commit suicide and I test positive, I cannot go in that number, Darian. That's madness. I've been looking up death statistics. The way that people die, we know. You're intelligent enough. Everybody in the medical field is intelligent enough that they know the difference between COVID was a decent factor or James Gray died in a car accident and just happened to test positive for COVID. That type of manipulation is just, I think it would be hard to justify that.
No, I totally agree. I can say on our unit, I don't know if we've had any of those patients where... When
I heard that from Sparrow, I was speechless. I was like, I trust that person very much. And I know that the person that told me, I believe their word, but I was like, I just didn't want to accept it. And then when the Illinois public health director on television said it, I was like, this is unbelievable. We are determining the country's actions based off this number. You know what? If you want to count everyone in a separate thing and say, hey, this is how many people died with COVID in their system, fine, but accurately represent to the American people what is taking place so that we can learn together. You know what I'm saying? So, okay. So let's, I'm going to throw a couple things at you and you just give me your opinion on them. So places like USC in California has done antibody testing. Two other doctors that I posted video from this morning had thousands of patients that they showed antibody testing. Stanford pushed out results. Boston pushed out results. So all of these places are showing antibody tests, which what that does is it helps us figure out, hey, how widespread, as you know, is this virus? Because anyone that turns up positive for antibodies, that means they had it, they beat it, and they didn't die. So, you know what I mean? So what that does is it shoots the infection rates up extremely high, but the death rate stays the same, right? And as we clearly have just discussed, the death rate might be slightly manipulated. So just in New York City, they just published that at the time when the reporting said 250,000, they expected that just under 3 million people were actually infected. So when you look at it from that standpoint, and every one of these studies is coming to the same results, Stanford said that between 50 to 80 times more infections were taking place than what was being recorded at the time of their study. So if you look at that, it would take the threat that COVID presents and it would drive it into the ground. It wouldn't be this, if you looked at just however we're putting now, it says 4% of people die if you get COVID, period. And that's just not reality. And that fear has been the basis for all of this. So with all these studies coming across the nation, you're a healthcare professional, there's doctors, they're privy to this information, or it's out there. So if this information is out there, which is the truth, this isn't hypothesis, this isn't a model, this isn't us in the beginning going, you know what, we're going to take the safe route. This is irrefutable data. Why are we not looking at the data and then adjusting our actions? Because that's what we were waiting on. We were waiting on the data.
Right. I have no idea who does those numbers. I can say our hospital, too, is starting to do antibody testing. I actually got tested Friday.
I'm going Monday.
Okay, good. My results haven't come back yet. But, I think once my hospital gets everything done, we're hoping that we can see what the number is. There's probably a lot of us nurses, doctors, NPs, all medical professionals that had it and didn't even know. I can say on my unit alone, I believe there is 2 nurses so far that tested positive, but never showed any symptoms.
You actually led to my next question. My next question was, if this is this horribly dangerous, deadly virus, you nurses were told 1 week to wear a mask, 1 week don't wear a mask, 1 week do this, 1 week don't do that. Why wouldn't frontline workers, the people that are literally there hands-on with the patients, be dying at alarming rates if this was that deadly of an infection? Because you are in the heart of the infection where all the people are. Why wouldn't people like yourself be dropping dead left and right? Because it's obviously, you know what I mean, that bad. How does that make sense?
And it doesn't. I mean, like you said, the numbers are skewed. I think they are, hands down. The media hasn't helped it. That's the biggest thing. But it all comes back to everyone is different. Like I said, a lot of people, at least I can say for my unit, who have died have had comorbidities. Not one patient who I've had where they were young, healthy, didn't come out of there.
Gotcha.
Yeah. So that's why none of us are, all of us are have been fine.
So what you're painting a picture of is a large amount of the cases are going to heal themselves, because otherwise nurses and all the people that are in the hot spots that are right there fighting the virus in its face, you would be at a severe risk. If this thing was 5% of the people that get it are going to die, unfortunately, that would probably mean 5% of our healthcare workers that were in the middle of a pandemic when it broke out would have passed away. That's just the flat out reality.
Correct.
Yeah. So my understanding of herd immunity, which is a miracle that stops, that's why we vaccinate, right? Is like things like polio and stuff. We don't want to take our chance. So herd immunity comes in when either you vaccinate or you develop natural immunity to a certain level in a society so that the viral outbreak is quelled, right? So with that being said, the number one way that we protect elderly, that we protect immunocompromised, people with comorbidities, is healthy children and adults go out. They do end up in contact with viruses and influenza and all these things like that. They develop their antigens, they create immunity, and now they actually become like a or just a barrier for the people at high risk, right? That's always been my understanding of how herd immunity works. You and I actually had a conversation about vaccines not too long ago where you said, James, you need to vaccinate every single time because it's important. And anyone that watches this video, I want to be super clear. I'm not against vaccinations because, we don't want polio coming back. We don't want smallpox coming back. We don't want these are important things. But I also feel like if the chance of killing me from COVID turns out to be 0.0001% as a healthy adult without these other things, my body is going to produce the same immune response whether you inject me with a vaccine and I get it, or my body naturally produces that. Is that correct? And tell me about herd immunity. Am I correct on that?
That is correct. Essentially, since the day you were born, you're building up your whole immune system. You get part of your immunity from the mother, which that's what we were kind of hoping for in a sense, I guess, is these women who are pregnant and are giving birth to kids. It is passing through the kids. So far, almost all of the babies that I've been aware have been fine. Some of them might have had like breathing problems at first, but every child has made it. So we're hoping that kind of like if I had the COVID without knowing that these children already have antibodies to this. So yes, you're right with the herd immunity. It's like with anything, building up your immunity every year. Most of us do by not getting the flu, but we're still going out in public. A lot of us aren't getting it. But at the same time, I think the vaccines then drive the number down too, because every year I get the flu vaccine. For one, I do have to get it for work, and I can't even tell you the last time I had the flu. So I think they both work in that sense. I think we need herd immunity with these people who are testing positive, and then a vaccine for these people who haven't. Like I can say I've never had the chicken pox, so I have to get a booster for the vaccine every year. And
I had it when I was a kid.
Right. And like that instance, you can't ever get it again. That's never been proven that you can. So,
yeah.
I think you are right in the sense of we need to build everyone's immune system, but then I also think we need to come out with a
Of course.
vaccine.
So
to
either, I mean, a
almost,
vaccine, once we can get it, absolutely, it's a good thing. Then that way you don't even have to roll the dice. You don't have to say, hey, is my body strong enough to fight this off? Sure.
correct.
All right, so all the stats I was looking up with children, because I want to talk about kids real quick, because H1N1, I don't know if you've ever looked up this stat, killed over 1,200 children in America. Remember, Obama was president, H1N1 came around. I think I lightly heard about it on the news. Someone said H1N1. It wasn't really, that was about as far as it went. We didn't lock down. There was nothing. 1,200 kids. I looked up the statistics here for COVID. Not a single child under 1 year old in the entire country with a widespread pandemic per the CDC has passed away as of yesterday when I looked at the stats. Not one. Now, during that same time frame, to give people perspective, over 3,000 babies under 1 year old have passed away in the same timeline, and 30 of them died from pneumonia. So as you go down the chart and you look at all these different things, it actually shows that COVID is like non-exist, you know, like such a small threat to babies, children, and healthy adults. So flattening the curve, to go back to that for a half a second, was just about, hey, don't overrun Darien and our hospital workers. But the moment that passed, okay, so the moment a surge passed, we're not going to get overrun, all those things. Why do we not instantly open at least to our healthy people without major immunocompromise, people without comorbidity? You know, millions are out of work right now, and crazy amount of other things are going on. Alcohol abuse is going up, domestic abuse is going up. There's all these things taking place. When you take someone's paycheck from them, you're increasing poverty, you're increasing debt. So if it was just about flattening the curve, the moment the curve is not, the moment we're not overrun, why are we not right away lifting our lockdowns? I don't understand. I can't find the science behind that, because we want this out of our society as quickly as possible with our healthy people.
So a lot of us at work were talking about that. So because I get them trying to do the phases, slowly opening the community back up to full society. And we were all thinking, well, yes, phases will probably work. And that keeps kind of like the curve flattened, but keep the patients rolling in. We know that once people start going back out, there's going to be another spike in numbers. So we were like, okay, why not start now? Because then us healthcare workers don't want to be like, okay, we're done with this. Because no one's going out, no one's doing anything. We're done. We might get a break, but we know that once it opens back up, we're going to get the next wave of people. So most of us think like, yes, let's start opening back up. Do it slowly. I mean, none of us want that high second wave again, but start opening up slowly. It keeps us consistent and keeps us rolling with the ball of taking care of these patients. And then once everyone's back to what I guess you could say a normal life, we know what we're doing, and it starts to just stay status quo.
So now I got a question for you. Over a week ago, Beaumont Wayne, I don't know if you're familiar with Beaumont Wayne Hospital, but Wayne is the hardest hit county here in Michigan. So this is where for the people that aren't from Michigan that are watching this video, this is the hardest hit community in Michigan. Beaumont Wayne, the COVID hospital, closed over a week ago. The whole hospital is shut down because they couldn't keep enough people in the hospital. That doesn't tell me that, we're getting there. The hospital in the hotspot shut down. That tells me that we should have been opening up. That means the peak has been quelled for weeks now, or at least a significant amount of time, because for a hospital to close in a pandemic, that is a massive warning, or like a massive red flag, as you will, whatever you would like to call that. Did you hear about Beaumont Wayne closing down? What type of reasoning do they give for that? How is that not just irrefutable proof that it's time to get healthy people back outside, so that, businesses that are at risk, families that are at risk, all of these things get back online? Like, why is that not just instantly the sign to get back?
So I can't speak for Beaumont Wayne because there's been so many rumors. I mean, there's rumors about hospitals all over Michigan.
I don't want to talk about any rumors. Like,
no,
is
right.
It closed?
It is closed, yes.
Okay.
No, but we're just like, even like rumors like how this hospital's handling one thing, how this hospital's handling another thing. I don't know if it closed because of the numbers. There's also been talk that they closed so they can clean it, because the big moneymaker for any hospital surgeries. No one's
Of course,
doing
elective
surgeries.
surgeries, sure.
So then we were hearing, are they going to open it back up soon? And then we're going to start doing surgeries at certain hospitals. And so I can't speak for
But
them.
sounds like the COVID spike is behind us, though, because, I mean, hearing all those things, you have in the midst of a pandemic, you have a hospital closed trying to figure out what their next strategic move is. You know, that doesn't sound like the war zone anymore.
And that's the funny part. I love how you use the term war zone.
Well, hey, the news used it, so I'm just using what they actually in one headline said the apocalyptic surge. Right. Apocalypse.
Yeah. I can say for the hospital that I work at, was it stressful at first? Absolutely. It was something new for us. None of us nurses cared to wear these masks and these gowns. I mean, I can tell you we're in these rooms for at least an hour and we're sweating. I mean, they suck. So, but as for a war zone, it's been hectic certain days. I can tell you one day we lost 6 patients, all in maybe 16 hours. It sucks. But I wouldn't say it was ever a war zone. I was never tripled with patients. Our max ratio is about 2 patients to 1 nurse. I never felt like overwhelmed.
I'm glad you addressed that.
Yeah. And we get updates for our hospitals. And yes, we get a graft. And as of right now, it is on the downcline. Yes.
Has it been on a downcline for a significant amount of time in the way of like people dying in this? Because I don't want to like focus on like so many people in the news and media are talking about cases, but like what is the relevancy of cases when you're talking about like if right now, like I said, imagine if every day on my Facebook I posted how many people were infected by influenza, and then the next day I added to that number, it would create this fear like, oh my God, there's a virus. What we need to look at is what is the threat that it is causing right now? How much damage is it doing? You know what I mean? I feel like we're focusing a lot of the times on the wrong metrics. I hear people saying that until we can test everyone, we can't open our doors again. That doesn't match with any type of science. Like you take studies and you extrapolate information from the studies and you apply them to learn the reality of the situation. Like that's how I've always done math or science. So do you think from your perspective, someone in an ICU, before we can all leave our homes again, do we need to like have this testing that we can all say, oh my God, I don't have the COVID, or I've already had it and I have the antibodies and now I can resume life?
I mean, I feel like just in general as a normal human being, that's hard to do. I mean, for one, who says that I want to be tested? I don't know if you can force someone to get tested, because then why don't we do that every year for the flu?
I'm glad you said that, because that's what I was about to say to you. I was going to say, if you accept that as the procedure that should take place, if the flu kills up to 60 or 80,000 people a year, that means every single flu season we would need to lock our country down and one by one test. That's just not reality. And there's a lot. Let's speak, because you're in a healthcare position that you would know this better than me. I feel like most either genetic or self-inflicted things are probably killing people in people's lifestyle choices, nutritional choices, the way that they, smokers, people that drink alcohol excessively. These things have to be killing people at a alarming, like heart disease and stuff that's promoted by horrible health. People that don't drink enough water, right? You might know.
Oh God.
Like that. So what I'm saying is like self-inflicted things are probably killing. I didn't know the stats on heart disease and from damages from drinking alcohol excessively and smoking. It is alarming. I was speechless at the numbers that I stumbled across, because you just don't know. So all of a sudden, we're so terrified about our health that we shut the entire country down. But when I looked at the stats, at least from my perspective, the way I'm seeing them, you are like substantially more likely to kill yourself by a crazy factor just by the choices that you're making than by catching coronavirus.
Yeah, that's probably correct.
Okay, so I want to address something else. I've been watching every White House briefing, as crazy as that is. I've watched, whether they're 3.5 or 4 hours, I have not missed a single one from February, right? Because I had nothing better to do. And I said, you know what, I'm going to get a grasp on this thing before I start going public with, hey, is it what they're saying? Is it worse? Is it better? Okay, so Dr. Fauci on television said, realistically, we should probably never shake hands again. That to me was one of the most insulting things I have ever heard from an expert, and I'm going to explain why, and you can tell me what your opinions are, because I keep hearing this new normal, right? The way we improve our ability to fight disease and our body's natural flora and our antigens and our ability to respond to things is by interacting with germs and bacteria. I mean, you know, as a medical professional that we have staph on our body, we have these germs, we have all of these things, right? If we get to a world where everybody, every 15 minutes is washing their hands and Lysoling their arms and Purelling their body, like the Always Sunny Philadelphia with Frank, right? That is literally going to create damage. You need to be exposed to bacteria and viruses and stuff. That's what, as you said in the beginning, that's what babies do. Babies touch everything and then touch their mouth, right? And then that's how their immune system is like, whoa, we got to keep this little thing alive because it won't stop putting its fingers in its mouth. This idea that everyone should be wearing a mask and we all need to have gloves on, we all need to wash our hands every 15 minutes, that is, at least to my understanding, directly against the way the human immune system works, is strengthened, is all of these things. Just tell me, what am I wrong? Am I right? What's the reality of this? Like, and I'm not talking about if you have a major comorbidity or you are immunocompromised. That is a different situation. I'm talking about for the regular population of human beings. Is this new normal the answer?
I mean, I don't think so. I think, because then I start to think, okay, why now? I mean, why are we doing this now? Like you said, there's been millions of diseases, even ones we have no idea about. Why are we doing that now? And do I think gloves are the answer? No, because I still think it's hilarious going to the store. People have gloves on, they're touching their phone, and I guarantee you about half those people are not then washing their phone when they get home.
Of course.
Or you see people who, like today, I actually went to the grocery store, saw someone get in their car with their gloves, touch the steering wheel, and I'm going to take the chances that he's not going to wipe that down when he gets home.
Of course.
So really, what's the point?
Yeah, because at the end of the day, if you're not going to truly do it effectively, it's just a mess, and you're creating all this stress and all these other things for yourself. Like, even in lockdown, you have people sitting at home, not going outside, very fearful, very nervous. I mean, we have anxiety problems in this country in general. You have people terrified. So now all of a sudden you have all these people clustered together. They're afraid. The news is telling them they have a high chance of dying. They're not getting out in the sunshine. They're not getting out in the fresh air. That is I don't think a doctor out there would say that that is not damaging to your immune system and your health. That probably makes you more likely to become ill because you're not living, you're not going outside and hugging your family. I've seen people during this hugging people through shower curtains. I've seen people, looking at their grandchildren through windows. There's a certain point where madness takes over science and logic. And I feel like that line is being distorted really bad, right? Our species has survived since whenever you believe we started because of our immune system and our ability to interact in the world. The idea that we're going to, like, how do you do jujitsu in a new norm? Can you explain that to me? Because I can't figure it out.
So that was going to be my question for you.
Please explain to me. Explain to me how in a world where people are afraid to shake hands, you are able, I can be on top of someone, sweating on them, breathing on them, trying to strangle them. It's not humanly possible, right? So I spoke to a doctor, I spoke to a House of Representatives member, and when I presented this to the House of Representative member, he literally looked right at me in the interview and said, like, I really didn't consider that. You know what I mean? But lack of understanding of the immune system, lack of understanding of, like, you wearing the gloves and the mask and you're not doing anything. It can live up to 3 days on plastic, right? I think that's what I read. The water bottle that you just bought from the gas station could absolutely have the bacteria that now you're huddled in your home, right? So I'm going to go one other thing with the lockdowns and anything else that if I cover something, because I talk a lot often and you want to talk about it, go ahead. But one of the things with the lockdown, the leading virologist out of Germany said, and they published in a study, that he believes our lockdowns are increasing the chances of people to get ill because you have people during a respiratory infection that could very well be asymptomatic, could be mild, could all clustering and containing themselves together in a home instead of being outside in sunshine and fresh air and doing the normal things that human beings do, that he published and publicly stated. You're actually more likely to get, if I'm quarantined and my dad is very sick with coronavirus in my house, which I know that you can't quarantine all the people during this outbreak at hospitals, but hospitals sent home thousands and thousands of positive people back to their homes, right, to quarantine.
Mm-hmm.
Now imagine me sitting in that home with a respiratory infection, with that person breathing that air out. And am I more likely to be in trouble with a respiratory infection being stuck indoors or being able to be outside in the sunshine? Because you see people getting ticketed at parks, getting given, $1,000 fines for being outside. There's a certain amount of madness here that I'm trying to sort through. What are your thoughts on this?
I mean, in all, yes, when you're sick, you should obviously keep away from people. I mean, no one then wants to get your family member sick or your loved one, all that. So I think in general, yes, you should somewhat keep yourself contained to a degree. I mean, we've learned that since you were a kid. I mean, if you were sick, you didn't go to school. But then at the same time, I remember being a kid and my mom was like, go sweat it off, go for a run, go do something.
Your mom knew you had an immune system and she believed in it.
Right. So yeah, I think coming from all this, people are scared, whether it's from the numbers they've seen or from the media or even just talking to a healthcare professional. I get being scared because it's new. Do I think this is the right way to go about things? That's hard for me to say. I don't know. I can say part of me is a little bit selfish. I want to get back to normal. I can say the gym has been a huge outlet for me. I miss it like crazy. Even just little stuff. Chris and I go play ball. He is in a huge, does sanctioned softball. He's going nuts wanting to get back to work. He misses that like crazy. And I don't think being locked down is the way to go. Because like you said, if you're just sitting there at home, it's just like festering. And
yeah, sure.
Then if you're with someone who's at home, they're just going to get it. And that seems to have been the trend. I remember I had one patient, and it's sad to say he got it because he went to go visit his brother who probably had it to drop off toilet paper to him, and then he got it. And unfortunately, that patient passed away. If he was maybe out doing stuff and, I don't know, being back to normal, would it have maybe changed anything? I don't know.
Yeah, so, I mean, like I said, there's just a lot of, just really tough decisions in this case. But I feel like so much of this, and this could be the fault of the media, and this could be the fault of this, so much of this was not really based on science and our understanding of the immune system and our understanding of viruses. This was a very emotionally driven reaction, which I can understand initially. Initially from the start, you know me because you know me. I quarantined from the start. My girlfriend is immunocompromised. From the start of this thing, I quarantined. I follow every protocol. I just started looking at things and saying, okay, I want to see why I'm quarantining to verify that, while I take on tens of thousands of dollars of debt and maybe can never open my business again, I want to know that I'm actually making a difference. You know what I mean? So I'm going to quickly shift to what their plans are. So if I don't know if you followed the phase 1, phase 2, phase 3, phase 4 guidelines. Basically, something like jujitsu, like a hands-on, touching of each other. Many governors and many people are saying that this could be 6 months down the road. Because they're saying, hey, first we start basic essential. I've heard people talking about putting people back in restaurants, making the restaurant people wear masks and gloves and be careful of the distance. Again, we're going back to, if we have healthy people with an immune system not showing symptoms, when you start introducing into people's mind that is a normal way to live, I don't even think that is actually enhancing their ability to fight infections in the world. The person that sits home and Lysols everything and lives in anxiety that there's some scary virus outside is going to be more likely on a scientific level to fall ill when they encounter that than me that probably just ate the pizza on the counter from 2 days ago. You know what I mean? And obviously that's an extreme example. What I mean is your body does respond when faced with viruses and bacteria. So now, at what point, you know what, I shouldn't say this on video, but I'm just going to, and it is what it is. I already have a date set in my mind based on once I got to the point where I had enough information compiled that I feel very strongly for my stance. I've interviewed many experts. I've spoken to a wide range of people. I've spent my entire days studying this to make sure that I wouldn't make the wrong decision and put lives at risk. But I'm about to lose my home. I'm about to lose my business. So I said, you know what? If I'm going to lose all these things, I want to know where I'm at. So with that being said, I already have a date set in my mind that on this day, I'm going to publicly put out a video that says, here's all the research I've done. Here's all the people I've spoken to. Here's all the things I've done. With that being the case, here's the guidelines that I'm going to set for my academy. Like over this certain age, can't come in. We're going to set these protocols. If you live with someone that's at these things, please don't come in. But I'm going to open my doors again, regardless of what the governor, regardless of what the police, I don't care. And because I've studied the science, I've talked to all the experts, I've followed all the studies, and I feel that in a country, I was born and raised with the American spirit. I believe in a certain amount of freedom. Every aspect of life has risk. If you got in your car to drive to my gym, you just took a risk. If you went to that gas station, you took a risk. If you went in, if you're a frontline worker like you took major risks throughout this thing. To think that I have to lose everything that I've built and everything that I've worked for in a decade of my life, when I try to spend my life helping people, that I have to lose all of that simply because someone wrote on a piece of paper that you're not, until 6 months down the road, allowed to operate again. I can't accept that and won't accept that when it's not based by facts. If you could sit me down and say, this is why, you know what? I would probably come around. I'm a rational person, I like to think. You hearing that, you being an ICU nurse, knowing that my stance, and I'm flat out saying, I'll put in guidelines. I'm actually probably going to reach out to you and say, hey, can you help me create just the most practical guidelines possible? But I am going to open my doors again. Give me your thoughts on that.
I mean, it's hard. Like I said, from the personal standpoint, I mean, I would love that. I go to your gym, obviously. I miss it like crazy. From a nurse standpoint, I mean, yeah, I think that, like, we do need to build our immunity up to this. Would it hurt? I mean, I don't know.
How do we build our immunity up to it? Define that for me.
Right. But like you say, like interacting with people, you have to beat it. Like you said, everyone's immune system is different. I can say personally, I feel like my immune system is a lot better than my boyfriend's. He has gotten the flu twice and I haven't. Now, yes, I got the vaccine and he didn't, but who's to say that's why? I mean, he also seems, I feel like he is at higher risk for bronchitis. I've never had it. I think part of that is because my immune system's a lot better. For one, being in the hospital, who knows what these people have.
Sure.
And we aren't wearing masks at that time. So I don't know if I'd be completely against it about someone like you opening their doors. I mean, I get it. Like you said, for one, it's your life. I mean, that's your business. That's how you make money. That's literally how you make your living. And
that's the thing, like, it's not just me. Imagine millions of people across this country that are about to lose their homes, their cars, their jobs, their careers, everything they've built for something that, like, all of the science says healthy kids and adults absolutely crush it. You don't have a single death of someone under 1 year old. You have less than 10 on any children in general. You don't, like, help. I don't think when you look at the chances, if you're a child or a young adult in this country, it would be like 0.00001% of you passing away from COVID. And I'm supposed to, not just me, take me out of it because I don't want to sound selfish. It's just everyone in my situation is supposed to lose everything that they've had over what science doesn't back. This isn't Ebola. It's just not.
Right. I think I can say my final answer is I just don't know. I think part of me wants to, yes, let's get everything back to normal. But then, like, the personal side of me is like, okay, let's say I'm positive, I'm asymptomatic, I come to your gym, and now I got someone else sick. Then I just don't want it in my head. Like, I could have been the reason that they almost, if they become super sick, that they might have passed. I don't know.
Asymptomatic shedding, as they call it, like silent spreaders. What is the prevalence of this? Because normally it's like, you know, the fear is like the people that cough because, like, I'm symptomatic, which means the virus is doing a number on me. Because asymptomatic generally means that I have a more mild version of the infection, right? Or my body's handling it better, so I don't even show symptoms, right? Versus if I'm symptomatic, it's giving me trouble breathing, and I cough on you, right? Obviously, I have a substantially higher chance of spreading that to you. Explain to me someone because you just used a good analogy. You're a young, healthy adult, you have no symptoms, you don't cough, you're not doing these things. Is that common for asymptomatic to spread the way that the symptomatic person was? Because I'm obviously going to say anyone that has any symptoms, you can't come in. I can buy a temperature thing. If you have a temperature, you can't train. If you're over a certain age, we're not willing to take the risk. I can implement all those things. But as soon as someone can say, well, an asymptomatic person could kill the person next to you, there's just certain, like, I could win the lottery. I could play today and be a millionaire tomorrow. It is possible. But we have to weigh risk, right? Like, am I more at risk from the nutrition that I eat right now or an asymptomatic carrier of COVID-19 killing me? We have to put it into perspective. How often do asymptomatic people spread diseases? And I know it's possible. I've done the research on that. But, like, I thought it was a very, very small amount as comparison to people that have symptoms that are coughing on other people. Explain that to me.
Right. I mean, that is really not my area, so I don't want to give the wrong information.
No, I appreciate the honesty on that.
Right. So I would assume if I'm asymptomatic, I don't know that if I cough,
why are you even coughing if you're asymptomatic? You have no symptoms. We don't cough regularly, right?
Right. But I mean, like, let's say I clear my throat. I mean, that's still like secretion. So, like, let's say I'm clearing my throat and I cough. Is that little droplet, like, positive with COVID? I don't know. That's
a phenomenal question, because I actually brought that up to the doctor that I interviewed, who is a master in biochemistry, and he's a medical doctor, and because he went to this science for me, and he was explaining to me there's a thing called viral load, where a certain amount of the virus has to penetrate the body for it to even be able to replicate, and then people have different viral loads, and different sicknesses have different viral loads. He explained all this to me. I had no idea, but it was interesting to hear. So asymptomatic, like you said, someone that clears their throat is drastically different than the patient that's running the fever, that's having trouble breathing, that's coughing up on top of you. You know what I mean? So I'm not saying that there is not risk. I want to be super clear on that. What I am saying, if you drove in your car today, you took a risk. How many people in this country drink alcohol? What is the risk of that? And that's self-inflicted. You're choosing to do that. How many people smoke cigarettes? How many people do that? What is the AIDS and sexual transmitted disease chance of killing yourself in this country? And how many people really take that seriously? So at a certain point, how many millions of people should have to lose their livelihood over, well, there's a tiny chance that this could take place? Is life not like weighing risks?
No. I mean, I think your whole life is a risk. You take chances. So yeah, I mean, in all of this whole disease, I don't know if even I personally fully know what to take from it, because I feel like I am getting pulled from both sides. I mean, the medical side, I don't want anything to happen to patients. You just want to treat them. You want them to get 100% better. But at the same side, life needs to get back to normal. There's things I miss, which is being selfish, but then...
But way beyond that, because, like, I want to be clear that, like, on the needs to get back to normal. If we were all just like in a frozen state, let's say the government suspended mortgage payments, rent payments, like my landlord, he's a phenomenal guy, but he flat out said basically, like, whatever money that you did not pay while you were closed, I'm going to take that and space that out over the course of the next year. So as of right now, my rent the moment I reopen is $2,000 a month more than what I was paying. So most people's house payment, double that, add it on. And now, how many people, due to the media's fear and all of these things, are going to slowly trickle back in because they are terrified. They don't understand these things. So it's like, I'm not talking about, because if you say, like, well, we want to get back to normal, I'm not talking about going to Starbucks. I'm not be like, oh, I missed my Frappuccino. I'm saying millions of people right now are taking major debt and losing their ability to provide for their family at a very minimal risk when you look at all the antibody studies, when you look at all these things, and knowing that we are not only heavily trending down. I mean, like, how many severe COVID cases do you have in the hospital right now that, like, they're going to pass away? If like, just in a broad, I don't want you to say names or anything like that, but, like, compared to the worst, are we anywhere near that?
That's hard to say. I can say like everyone in the ICUs right now, they're pretty critical. We're seeing the trend that, like I mentioned earlier in the video, not many have been discharged from our unit. Maybe roughly under 20.
Yeah, yours is the critical unit.
Yes. But as for the rest of the hospital, because, I mean, how hospitals work is you get so stuck in your unit, you don't see what else is, like, going on.
I understand.
Yeah, so as for the rest of the hospital, I can't account for.
So if you were to look up, let's say, like the antibody studies and all these things, and it's showing, irrefutably based on the data that the chances of this passing, let's say it's dead even with the flu. You wouldn't think that because the flu comes around every season that millions of people should lose their homes and because if COVID and the flu are the same thing in the way of the chances of it killing you, right? If that's what all the studies are showing, which I'm going to send you right after, if they're on an even playing field, and we would never cause millions of people to lose everything with the flu because it's going to happen till the dawn of time. I mean, coronavirus could literally mutate, and this could be another thing that until the end of our species, it's just when there's a flu season, we have two things that we kind of got to be careful about. But if we would not destroy lives over the flu, and coronavirus has about the same threat or even reasonably close, how could you possibly justify doing it? I don't understand.
I don't think you can justify it.
Okay.
Yeah. I think it all just comes down to we're like this. And I don't know why they chose to do this, because looking back on it, I did question, and now I was younger, but why didn't we do this for the H1N1? I mean, I don't know why.
Or swine flu. Swine flu is H1N1, but we had bird flu, we had Zika, we had West Nile, we had Ebola. How long ago was Ebola in the news? I remember hearing Ebola was coming and we were getting toast. Like we were going to get taken out. You remember it?
Yes, that I do remember.
What happened? Where did Ebola go? I mean, it's like someone snapped their fingers and Ebola was gone. What happened?
Right. So I don't know how, like, why they chose this. I don't know the government side of this, where they pick and choose on why we needed to shut down. I don't get it. And I don't know how that worked with the whole Ebola thing. I remember, like you said, it was a huge thing, and then all of a sudden it just stopped. No one got it besides a handful of people, and that was it.
Yeah, so, and like I said, H1N1 was killing kids. Over 1,000 children were dying. Right now, the way the media is reporting on this, if kids were dying, it would be the #1 thing you saw on television, period, because no one ever wants to see a child pass away. 1,200 die, nothing happens. Normal, the fact that viruses are part of our world, bacteria is part of our world, it's a very sad reality. No kids die, shut the entire country down. It doesn't matter what damage we do in the process. I can't find the correlation.
I don't have an answer for you on that. I don't.
All right. Well, I mean, I guess we've covered it really, really well, unless there's anything else that you could think of as like an ICU nurse that you would put into an interview. Otherwise, like, I just really appreciate your time so much. I kept harassing you to come on and talk. I'm sure it is difficult because you have been in a pandemic trying to sort your way through this. You are on the front lines in the epicenter in Michigan. You know what I mean? Because like the other reality that not a lot of people talk about is it's not widespread across Michigan that people are up in arms and hospitals are overrun. This is not the case. It's very small areas that are kind of the hot spots where either, and I don't want to speculate incorrectly, but either where like poverty levels or comorbidities or pre-existing conditions made it like, some gasoline on the ground and someone threw a match, right? This isn't the state of Michigan was in a state of panic. There was very small isolated areas, which is like what New York City would obviously be the pinnacle of that example, because you have people, like this on a subway cart going to work. So, it's very isolated in the way that it's not widespread across Michigan. I do not live in that area. My community is not a part of that. Our hospitals are not overrun. I mean, I've heard, can you verify for me that tons of doctors and hospitals and or hospital workers and nurses, I've heard they've even been being laid off or furloughed because there's literally just not enough cases or the hospitals don't want to lose money.
Right.
Is that true?
I mean, unfortunately, that I haven't looked into. I mean, I can say my hospital's not doing that. I think maybe my whole hospital system has started to do that. being on the selfish side, I don't think I've looked into that because I do have job security.
Sure. I mean, you are the front line. But you would agree with the statement of it was very isolated areas that were hotspots for whatever reason.
Right. So, and that's good that you mentioned, because I was going to mention too, it's hard to say about numbers because perfect example is maybe a couple weeks ago when my whole unit was full. We counted all patients, which is a 20-bed unit, and it's sad to say, nothing against anyone, but only 4 out of 20 were Caucasian. Everyone else was African American, obese, with hypertension and diabetes.
That is
right?
That is 80% of. Wait, and time out. Because I'm uneducated in certain ways that you are educated. You just told me 20. When I'm thinking of, we don't want to overload our hospitals. In my mind, I'm thinking of thousands of critical patients in the hospital, because like that's what overrun. 20 beds, is that the limit?
20 beds is the limit in an ICU. Well, not for our hospital. That's just how our unit is made. So all of our ICUs are 20 beds max. Now, other units are big.
I was thinking you had the capability to treat hundreds or thousands. Well, probably not thousands, but I was thinking hundreds and hundreds of, severe cases could be treated at once. Our hospital really can only, an ICU like yours handles 20 people that are in severe condition at once. That's correct?
Correct.
Wow, I had no idea. So in my mind, I'm thinking, because, the numbers you would see on television or the way that you're being told, I was picturing you had hundreds or possibly thousands of people in a close area on their deathbed, either being saved or dying.
I can say that our one step-down unit that got hit hard first, now that is about, I think, like a 50-bed unit. I can say a lot of them were probably on the border of being critical to being like more of just a serious condition. I did get pulled to that unit at one point to help with intubations when we were like in the peak of things.
Gotcha.
Us ICU nurses went down there to help because there's medications we can help with that were certified compared to our progressive nurses. And that unit, yes, that I felt for those nurses because too, with my unit being an ICU, and I told you earlier, almost all of our patients are intubated. When you are intubated, that's a closed system. So when that person coughs, it is in the tube. So I'm not really getting the droplets that the step-down unit was getting because all their patients are intubated. It's an open system.
So wait, real quick, just because I don't want to forget this and then mess up. So I'm on a ventilator. I have a terrible COVID infection. It's a closed system. Like, I totally understand that. I'm coughing into this thing. It's purifying and killing the viruses, and then I'm breathing fresh air? Or am I breathing in the virus in a closed circuit, which would, I mean, from just a simple standpoint, that seems like it would be more likely to cause further harm, because viral load is a real thing. If you continue in a closed system and not fresh air, that might kill me. But it's purifying, it's killing. I mean, I'm obviously thinking it's doing things to make it better being on a ventilator, right?
Yeah, I mean, there's a filter on a ventilator throughout
okay.
the tubing, yes. And
the viruses don't pass through. You have a filter where the viruses don't pass through?
Correct. Yeah.
Okay.
So
we're just saying, like, I just wanted to clarify that.
So I'm just saying, by a closed system, it's because that tube's in your lung, all those droplets that you would cough, even though we don't see them.
You're not being exposed to it then.
Correct. But now the step-down unit where these patients aren't intubated, a lot of those nurses were out of work. I can say at one point they were down 30 nurses, and I felt for that unit.
How many of those nurses passed away, just in general, no names or anything like that, but like getting COVID because they were in the heart of this epicenter? How many of the nurses passed away?
From what I'm told, I mean, don't quote me on this, but I don't think anyone has. I know I've been told that there is a nurse who is in critical condition, but I don't know what unit she worked for. I don't know if she works for, I think she works for our hospital system, but I don't know what unit she was on.
So you really touched on something that is incredibly interesting, that at one point, 80% of the people we're all minorities or not Caucasian. We'll just keep it at that. And that is incredibly fascinating because it says either one of two things, that at least from the quick assumptions that I'm making. It either says that somehow this virus is more inclined on a genetic level to attack that, or poverty and certain things, or certain conditions or comorbidities, obesity, things like that, horribly escalate, the severity of it. Why do you think? Because that's a huge revelation there, right? So 80% is a massive factor. And that's obviously just a very small case study, but I've actually seen many, many people suggest that this was attacking, different races at a different rate. And obviously everyone on Facebook smashed that. Oh yeah, the virus is racist. You're not implying that by any means. What you're saying is, this is what I see. What do you think is the cause of that? Because that is a huge thing to look into.
So a couple of us nurses were talking about it, like why are certain ethnicities at higher risk? I think one, it comes down to a cultural thing. Their cultural norm is to be in big groups, all be together, which then increases the infection rate. And certain ethnicities are at high risk of diabetes, hypertension, and all that. And I think what we saw on my unit is it was just like that trifecta of being obese with hypertension and diabetes, and then they just...
Did anyone in your unit pass away that didn't fit one of those four denominators that you just talked about? Either and take out white and black and take out all that, just either hypertension, diabetes, like a major obesity, or obviously one of the racial things that you point out, or whether they're black or Mexican or Asian or anything like that. Did anyone pass away that didn't fit one of those denominators?
From what I can remember, I think almost everyone did fit those denominators. I don't know if I can remember that one person didn't have one of those. There might have been one, but other than that, I think everyone had at least one of those factors.
So think about this. I mean, because we're going back to the risk that this presents the general population and healthy people, young kids and young adults, like people like me, considering opening back up. I don't fit any of those descriptions. I don't have a single one of those things. So when COVID is a pandemic and it's happening everywhere, we have to look at the realities. We have to look at the facts. And if I don't fall into those categories, my normal threat of the virus, because when you look at overall case mortality, you're just taking in anyone that gets infected, what are the chances of dying? But when you add in those denominators, that's probably where the deaths are taking place, which would then take away from the people that do not fit those descriptions. So this is stuff that has to be openly talked about, because it would change our perception. You just saying that has completely led me on to, after we get off this interview, I'm going to be researching, like, how many people are talking about that? How often are those factors the common denominator? Are they reporting it in that fashion so that you can easily see the correlation? Because that is how you make a reality. That's how you paint a proper picture.
Right. No, and I agree, because I think, like, for the patients who have passed on my unit, I think, yes, COVID is, how we talked about earlier, kind of what pushed them over the edge, but then their comorbidities is what majorly declined them. I think with COVID, your body then is stressed. It's going through this whole ordeal of trying to fight an infection. Well, when your body becomes stressed, your blood sugar tends to increase, because I've had a lot of patients go, oh, my sugar's never been that high after surgery, but your body's stressed without you even knowing it. Well, then the trend seemed to be, okay, their sugars go through the roof. We then put these patients on insulin drips. Well, with diabetes comes kidney disease. Well, now their kidneys are shutting down, so now we're putting them on CRT, and now they're crashing.
It's just a terrible chain.
Right. And the ball just kept rolling, and then a lot of them have passed.
Gotcha. So in light of this all, we obviously have a way better understanding of where we are now. We have the data available. I mean, because it's been going on for a couple months now. So obviously you're not going to have double-blind clinical studies where you were able to, from a neutral standpoint, look at this thing. We're not going to have that. But we have enough information in front of us, if we compiled across the nation and we have our experts look at this, that we can make realistic, intelligent decisions about what we know about the virus, right?
Right.
All right. So you'll probably see a video from me saying, hey, these are all the things, you know, of why I'm making the decisions I'm making and where I'm at. And like I said, I really appreciate you talking to me about this. I think the more we capture this information, the more we educate the people, this is going to be something that, you know, now we might have to live with forever, because I didn't even know, I'm one of the people, and I'll admit, I didn't even know that coronaviruses have been around for decades. You actually might have been the person that informed me of that. And then I started doing my research. I didn't even know coronaviruses were a thing. And I believe a lot of people, all of a sudden they heard COVID-19 and they thought this brand new thing that we have never experienced in the history of the world took place, where really it's just a new strain of something that's been around for decades that was always just lumped into flu-like illnesses. You know what I mean? And what we need to do is we need to look at the information accurately. We need to make intelligent decisions, and we need to be able to get the millions of people's lives, you know, that are struggling back on track. Because if it turns out that we ruined countless other things simply out of fear, media response, whatever it is, we can't take that damage back. It's already done.
Yeah. I think definitely someone, I don't know who makes the decision, just needs to have all the facts in front of them, maybe get healthcare workers involved and rethink this.
I mean, imagine if you got a council of ICU workers, doctors, and experts, not academic experts, right? People that are hands-on, that witness this go down. You create a council and you sit them with the governor and you allow them to explain exactly what is taking place. We would be so much more informed. Actually, that's going to bring me to one last point that maybe you don't need to comment on, but it's something that has completely fascinated me from the beginning. Is it true that hydroxychloroquine and like zinc and, you know, azithromycin in a combination, you know, turned out that it was helping people? I saw a lot of people publishing that. I saw a lot of doctors talking about hydroxychloroquine when in the right combination at the right toxicity levels. As with all medicine, it was substantially helping. Did you see that was a treatment?
So I did see that we were using it. Yes, I can't comment on if it's worked or not, because by the time that these patients have gotten to us, usually those medications were like a 5-day course. And by the time they got to us, they've either...
Yeah, you're seeing the people at the absolute extreme. Like, really, it should have been implemented from the beginning. So where I was going with that question, a pandemic takes place. This worldwide outbreak goes on. It's incredible. It's, you know, it's dangerous. It's scary. People are terrified. You have medical professionals across the country starting to say, hey, this anti-malaria drug, which has been studied substantially, it affects the bronchial glands in the lungs, which, you know, as in a respiratory infection is massive. We see that this can save lives, which is huge, because you don't have the time to do studies. You can't run FDA trials. You gotta try to, the people that are in your unit were already counting on you probably before they got there, right? So all of this is taking place. You have medical doctors saying that this is something. Our legislation in Michigan issued an order directly from Laura that I found the PDF and I read through, that threatened to take away doctors and pharmacists' license if they prescribed hydroxychloroquine for the treatment of COVID-19. You have your medical experts saying we can save lives. We had someone in New York saying I've treated 699 positive COVID patients without a single one needing hospitalization using this the moment they started to show symptoms. Our legislation said that you could lose your license and that you could, you know, same as a pharmacist. Now, obviously, it got overruled. I don't want to go down where it went to. How to explain that to me in the midst of a pandemic, while people are up to 2.2 million people are going to die, is what we thought at the time. Up to 2.2 million people could die. That was the London Imperial model, which proved to be crazy wrong. But you have medical professionals like yourself and doctors and experts saying we can save lives with this. Our legislation says don't you dare save lives. Final thoughts.
So yeah, when I think you actually sent me the link to that when that first all happened, because I hadn't even heard of that before. I think you mentioned it, and I went back to work and I said, is this true? And none of our NPs at the time, or PAs, or even residents had heard of it yet. So I don't know if it ever really got to my hospital that they were completely putting a shutdown on. No, because I remember that day they were still ordering it for patients.
So they were treating people with it. They were saying, hey, you know what, we're going to treat our patients regardless. It doesn't matter if legislation says you can't.
Yeah. Again, I don't know if they ever got the word that said that they couldn't, but yes, we were still treating patients with it. And
That's
I think
awesome.
we still are.
Well, that's huge.
Well,
because I
yeah.
thought, imagine if I saw my girlfriend or grandmother or anyone dying, and doctors across the nation were saying you can save their life with this, and some legislator said if you prescribe that, you'll lose your license. That to me, I couldn't even process in my brain, because especially because I try to put myself in people's shoes. If I'm a legislator and my healthcare professionals are telling me that we can save people's lives with this, and I say, don't do that. I don't know how that works. I can't even make that correlation. I don't understand where that thought process comes from. So, like I said, I appreciate you so much, Darian. I thank you for coming on. I can't even imagine how much of your time I've taken up. I've seen you have to look off camera a couple times. Like, I swear he's going to stop talking shortly. But this is a huge part of history, and it's something that you got to live through firsthand. You're going to have an account that very few people in the world have about COVID-19. And I appreciate you talking to me. You're welcome. All right. Well, you have a great day, Darian, and I'll send you this interview and any other links that you'd like about anything that we discussed, and then hopefully I see you back without too much of a new normal soon. Right. Absolutely. Can't wait to get back. All right. You have a great day, Darian. You too.